it's really it's really great to have you all here with us. Emanuela and I are excited about presenting first the research, but also this particular case. I think is really an inspiring case that we want to share with you. We really see that there is a revolution that's coming in healthcare, and it's something that we really feel that is a that we are part of and we want to support. And we see that Jean-Marc is here with us. Hello, Jean-Marc, from one of our certified mindset coaches.
Hi, Jean-Marc.
From Belgium.
Welcome back.
We have people from all over. So we have, so one Peter is in Glasgow and the other Peter and Ivan are in Bulgaria. And then Noha, where are you?
California.
You're in California. I'll be
here in Paris, Robert, right?
Yeah.
You're in Paris.
Yes, I'm in Paris for the moment.
Right now, yeah.
I think you have switched the locations for some reason.
Yes. Well, so what we'd like to do for this this webinar is we're going to kind of review the research and go over the model. So for some of you that might already know that, it'll be a little bit of review. But then we would like to present this case of the patient association for people with hepatitis C in Italy that has done just an amazing job of getting treatment and saving the lives of literally more than 200,000 people in just the past years. This is a particularly sort of moving for me because my partner, Todd Epstein, that I started NLP University with in the early 1990s, actually died of hepatitis C because there wasn't treatments available. And, you know, he picked it up from, you know, a treatment from a needle. And so I think also what they have done with this association is really something that's inspiring and also provides a good model because it was started by people who were just had a passion and a vision. And Emanuela, I pass it over to you. To anything else you'd like to say as our introduction?
Yeah, about hepatitis. Yes, also for me, this is a case that is really related to my personal history because I had a liver transplant 20 years ago. And from there, I started to work in the healthcare field just to give a contribution. And the person who started this case, who realized this success, had 2 times a liver transplant for hepatitis C. So we just analyzed with the success factor modeling for healthcare model and methodology their cases, just to see and just to go deeper to understand how they did this.
And I think what we'll see too is that the things that we've discovered in this case are not only limited to patient associations and certainly not just limited to people who are dealing with hepatitis C. It really is a model that can show us what you can do when you start with a passion and a vision. So I think we'd like to we'll go sort of give an overview of the research and the model that we have so far. We've also, things keep growing. We actually are hoping to be able to expand now with a partner into Romania. We have somebody who's interested in bringing the research there. So there's a lot that's taking place in this area of healthcare. Of course, the past couple of years where we are dealing with a global pandemic has really given us a motivation to take healthcare to another level. And we think that our research can be really helpful for that. So I'm going to go to our slides. For those of you who haven't seen this, this is our our logo over there on the right and our image of what we are looking at here, you see that there's this kind of constellation of all the different let's say stakeholders and actors in the healthcare ecosystem. And our goal with this research was to really look not just at a single individual or even a single hospital, but to look out at the ecosystem to say, when healthcare works, what is going right? What is happening? So, and we were using the methodology of success factor modeling, where we're asking this question, what's the difference that makes the difference? And that methodology in the past has been applied to things like entrepreneurship, collective intelligence and generative collaboration and leadership. And this actually, the inspiration for this research came, I think, from one of the success factor modeling programs was it back in 2015, Emanuela?
Yeah.
And Emanuela was there and approached me with this vision of how we might take success factor modeling and bring it into the healthcare field.
Yeah, and we started a new real challenge.
Yes. So, because part of it is, as we know, it's challenging. Healthcare is important, but it's also a very tight and in some ways rigid system. And to bring change into that is not so easy. And so our idea was to start by looking at what healthcare is already doing that works. So, how do we start by pacing and looking at, well, what is it that's already working that we can then add to? And the basic things we look at with success factor modeling are these three basic areas of mindset, which, as we'll see, is really central to the model that we have, because a mindset is what produces our actions, and actions create the outcomes that we achieve. So our whole approach was we wanted to look at, in any particular healthcare ecosystem, when things work, when you get the outcome that you are looking for, what were the actions that produce that? And then significantly, what was the mindset driving those actions, just like the software that drives a computer or a tablet or some other device. So, Emanuela, I'm going to pass it over to you to say how we did this study.
Yes, we built the study on several years, starting with a quantitative interviews and quantitative interviews by a survey. Why we started this? We started for identifying the key factors related to success performance in the whole healthcare ecosystem. So in several kind of areas like, yes, hospital and healthcare organization, but only government and pharmaceutical companies and so on. And organizing those success factors into a model and provide new tools to apply them. And already last years, we did a training and an healthcare, an effective healthcare mindset training by providing those new tools in order to provide a way to apply and to realize those success factors and to support individuals, groups, and organizations for applying them. And so, as I said, we started with 3 steps. The first steps was an online survey in order to understand and to define how people in their different roles define success in the health system. And then the second step was to explore the different levels of success factors, always with an online survey, just to asking to people to think about some specific success case examples from their point of view, in their role, in their context. And the third step, and tonight we are going to show one of those results. We made some face-to-face interviews, some qualitative interviews, in order to understand specifically the success factors, the mindset, and the key actions of specific case examples of success.
And just to give an example of the kind of numbers that we had for stage one, it was basically people were, we were asking people to think of a specific example of success from your position in the healthcare ecosystem. And that could have been any number of these places. The people could be doctors or nurses, but they could also be, some kind of regional institute, universities, could be pharmaceutical companies, could be patients and also family of patients. And we basically had 44 statements where, you just, all you had to do is click on the statement that sort of matched what characterized what you considered success. And we literally had hundreds of people. We started in Italy, but we've also since then run the survey in Greece, in France, and we had an international survey. So we've had hundreds of people. And then a subset of that group, a pretty large subset, went to the second level, where, as we'll show in just a moment, some of the kinds of questions we were exploring with them. And then we had very specific groups that were doing what we considered very inspiring and interesting things, that we went to this level of quantitative interviews. But our goal was, I think this is important, that we're not just trying to model a single individual or even a single hospital. We're looking at an ecosystem, because in our view, for example, for a doctor to be able to do what they do that's successful, there's a whole ecosystem of support. For a family member to be able to support their other family member who's healing, there's a whole ecosystem of support that when that's there, things work. When it's not there, there's a lot of challenges and a lot of obstacles. So the kinds of things we were looking at, and some of you might be familiar with this model, this is where we were looking at different levels of success factors, we would call it, where when we look at the outcomes, those are something in the environment. That's something that is able to be produced, that we're achieving some kind of healthcare result. And then the actions are at this level of behaviors. What we're calling mindset has to do with the things that support those behaviors and also support that environment. And these things have to do with things like capabilities and skills, motivational issues like values and beliefs, sense of identity, and a bigger sense of vision and purpose. And you'll see in the case that we present how all of those different levels are significant. And Emanuela, I'm going to pass it on to you to we'll summarize some of the thing. Oh, well, we also found passion was key.
Yeah, then this is the reason, because we are here now with you.
But so some of the main things that were kind of common to our success factors between our more in-depth studies in Italy, France, and Greece. I'll pass this on to Emanuela.
Yes, the first results in common about the success definition was to have clear and effective doctor-patient communication. And on the level of the environment, the two most important results have been tools or technologies, having tools or technologies, and to have an environment that supports interrelations. And on the level of the key action of the behaviors, the common results has been involvement and collaboration. And in the mindset area, on the level of capabilities, there were emotional intelligence and, again, communication skills. And on the level of values and beliefs, the values and beliefs have been, we are responsible for our success and patients come first among the 3 countries. And on the level of identity, the most frequent identity mindset have been co-creators and connectors mindset. And on the level of the vision and the purpose, the results in common has been enhancing patients' ability to face their illness with courage and hope. And in Italy, a few years ago, there is a professor in neuroscience, Professor Benedetti, Fabrizio Benedetti, who wrote a book about hope is like medication. He is one of the most expert in placebo effect. And he also has demonstrated how communication skills could have the same effect of medication.
I think this idea of, this bigger purpose to me was really very touching and inspiring. That this idea of enhancing the patient's ability to face their illness with courage and hope. And that's supported, all the way down by, tools and techniques and an environment that supports interrelations. It also seems significant that emotional intelligence and communication skills were deemed the most important capabilities more than any particular technical capability. And I think this was one of the kind of really big insights of our study. So we'll just to kind of go over the basics of the model, and then we'll go into our case so we can see a specific example of what this would look like. So we organize this model into those 3 areas, starting with the outcomes. And so we out of hundreds and hundreds of survey examples, our goal was to try to organize this to find what kind of categories would characterize the most common answers. So we were looking at what you might call the patterns that connect. And so one of the keys that certainly makes sense was it was important that there was expertise. But in support of that expertise, there was this the outcome of not just having expertise, but of engaging people, but also empowering people. And 2 of the others that came out were the importance in terms of efficiency and effectiveness. And we kind of distinguish those 2. They're clearly related, efficiency and effectiveness, but we like to say that, efficiency is typically about doing things right, whereas effectiveness is about doing the right things, because you can be efficient, but not necessarily effective. In other cases, you can be effective, even if you're not particularly efficient. So those 2 things actually complement each other. I sometimes illustrate that by the old joke about the doctor who comes out of the surgery and the family is saying, well, how did it go? Was the surgery successful? And the doctor says, oh yeah, the surgery was completely successful. The patient died, but the surgery was successful, meaning it was efficient, but not effective. So that was important for us to make that distinction, and you'll see how that fits in. Anything else you would add to those outcomes, Emanuela?
Yes, just to explain how we made, we took all the answers and then we categorized them just for association, by some association, and giving them a name. So Robert was really, really wonderful to find all the name with the E for the initial letter, but it was a case.
It works in English. I don't know how it works in other languages, but it does
Yeah.
work. Well, Manuel, I'll pass it over to you to go over it. So those all of those outcomes are supported by particular actions.
Yeah, the particular action, we categorize them in 5 factors about key actions that are related to some of those outcomes. So expertise is related to clarify and communicate, and then empowerment is related to communicate and care, and then care is related to effectiveness and efficiency, and co-create is related to efficiency, and collaborate is related to the engagement. But as you can see, is a star with and they are all related each other in some way.
Yeah, so the implication of the star is that, as Emanuela was saying, you know, engagement is generally supported by the action of collaboration. Efficiency requires co-creation, interestingly. Expertise requires clarification. There is no empowerment without communication, and effectiveness requires care. Now, again, we define these in much more detail as we go, but this is sort of giving us the overall compass, if you will, of the model. And then key was what we were calling the particular areas of mindset. And here you can see there's several different aspects. There's the capability, the value, the kind of primary value, and then the primary identity. And these mindsets tended to support 2 types of actions and 2 types of outcomes. So for example, if you look onto the upper right, we see that the connector mindset, which is all about connection and is supported by communication skills, is necessary to develop expertise and empowerment. You need that. And that's going to support the actions of clarifying and communicating. Whereas the builder mindset, which is about competence and self-awareness, that supports expertise and engagement. And of course, the actions there of clarifying and collaborating. Again, we can see that there's a catalyzer mindset, a co-creator mindset, what we call an enabler mindset. And then those have to do with particular values that are the priorities of that mindset, and then a particular skill. So the enabler has the value of compassion and the skill of emotional intelligence. The co-creator has the value of contribution and the skill of interpersonal skills. Catalyzer has the value of catalysis, making things happen, making things change, and has the skill of problem solving. Of course, all of those are important, but as we'll see, they come into focus when we are looking to achieve particular outcomes, and we'll see how all that fits together. And we'll also give examples of what was we chunk these down into specific examples in our case. Anything else you'd like to add to that, Emanuela?
Yes, only to add a simple reflection about the case that we are going to show, and the case that we already shared in the last webinar are about a big vision from one person who connected with other partnership, with other people, with other part of the ecosystem, who enabled something, who co-created something, who catalyzed, and by bringing a real transformation in the healthcare field, in the concept, in the mindset of people around them, and who built something really new and useful.
So we think this is, by the way, we think, and we've been told also, that this is a profound model, not only for healthcare. It can be used in many places, but of course it is for the whole ecosystem. But as Emanuela was saying, what we want to really focus on in this webinar here, and we also want to have a chance for you to ask some questions and interact. We want to just focus on this example of what's called EpaC, and I'm going to pass this over to Emanuela to explain. She already gave a little bit of background on this.
Yes, this man is the president of EpaC Association, that is a national association of patients, and is a no-profit organization. And he have made 2 liver transplant caused by hepatitis C for 2 times, because the illness came back. And when the new therapies for hepatitis C came, those therapies were really, really expensive. So government decided to give those therapies just for some kind of patients, the most severe, the most acute level of the illness. And they started a new project with a new vision, because their outcome were to give those therapies to all patients in order to get the hepatitis C to the 0 point in Italy. So to delete this kind of illness. And then
So let's see how
analyzed their
let's see how
case.
they did this. So what were the outcomes? So we see here's the sort of different these different outcomes with a little bit more detail. You know, that expertise means that team members know their roles and their tasks. That's what we know, that there's expertise. That empowerment is a very good relationship and interaction between team members, so that everybody's empowered to do what they need to. Effectiveness tends to organize around clear and effective physician-patient communication, but we could say any kind of caregiver communication. Efficiency is about very efficient and effective health provider organizations, so support for that. And then engagement is that all actors were involved. And in this case, the really key thing that they started with, their main outcome, was to put patients' health in the center. And it's that in some ways, you know, maybe that seems obvious, but in so many cases that we've seen that are not effective, the patient is actually not in the center. You know, sometimes the doctor's in the center, or the organization's in the center, or the funding is in the center. So to really do that and to keep that as a commitment, I think was really important. And so, Emanuela, we can go to the next one.
Yes. So what we found in the qualitative interview was that they wanted to be the only association in Italy that would take care of protecting the rights of patients with hepatitis C infections.
And we can see, we kind of put that up there, that was about both engagement and expertise. And also another one of their goals was to eliminate, you know, within a few years, eliminate the entire pathology, at least in Italy. That's what Manuel was saying about going to 0. And to do that, that fits in with the both effectiveness and efficiency.
And between empowerment and effectiveness, they wanted to ensure that all patients had access to medications or treatments without any discrimination.
And again, as we see from in the kind of this combination of engagement and efficiency, they wanted to create a more efficient and economical paradigm for treatments. So one of their, I think this lovely sort of almost paradoxical mottos was, the more you spend, the more you save, which I think was really interesting from the perspective of getting the type of funding that they needed.
And then they wanted to be a leader and pioneer in their field, so in the field of hepatitis C, and they are.
Mm-hmm. And let's see, so what did they do? So this was their goals. What did they do? So again, if we look at some of the actions, you know, clarifying has to do with routines and procedures. Communicating has to do with the protocols for communication or in addressing key issues. Care is strong interrelation between professionals to provide that care. Co-creating is about co-creating prescriptions for responding to particular situations. And of course, collaboration is involvement of the key actors and of course their ability to collaborate. So
the actions that they have made was to search for unidentified patients in the territory. So they went to look for where there were patients that was not formally, that was officially registered.
And they also wanted to provide continuing education and training in the field. So that was one of the things that they took specific action to do. And I think this whole idea of continuing education is so important because things are changing often so rapidly.
And diversified the sources of economic resources with donations from several donors and several sources.
And they, from the level of empowering to create the empowerment and the communication, they communicated and disseminated the good news so as they kept getting successes, they were communicating that by using multiple channels. And I think this is also key, this ability to show, here's what we're doing that's working. That encourages people, that creates this sort of positive, we could call a virtuous circle.
And they also arrived to over 200,000 patients that have been treated since 2015.
Which I think is just remarkable. I mean, that's almost miraculous that many people's lives have been saved in that short of a time. They also, again, part of what they did is to support expertise. They divided tasks and roles internally based on the qualities and personal skills. So remember, this is an association. It's largely volunteers. So it was really important to be able to have a way to really use people's expertise effectively.
And then they collaborated with NAS, that is the Anti-Sophistication and Healthcare Nucleus. So this is a specific kind of policemen that work in the field of drugs and some kind of these issues.
And the key thing here is they built a lot of relationships and partnerships, nationally, regionally, local institutions, external consultants, companies, associations. So this whole idea of really working to collaborate, because to again, be able to get the treatment of 200,000 people starting from nothing but this vision and passion, you've got to do a lot of collaborating and inspiring. And to me, I think that was a really key aspect of this.
Had regular meetings with all the actors involved, and in order to monitoring and to think in a strategic way and turn the message step by step.
And then, of course, they were constantly collecting, analyzing, and presenting data in a scientific way. So they were publishing 2 dossiers and scientific publications. So they were really also trying to build credibility in what they were doing. So again, these are some of the things that in order to achieve those pretty ambitious goals they needed to do, and that they did do. And all of this was driven ultimately by what we were saying is these aspects of mindset, the connector mindset, enabler, co-creator, catalyzer, and builder. So let's look at some of the things that they did there.
They chose the right people. So it's not only people who did the things right, but who can do the right things in the right way, in the right moment.
And again, the importance here is that this, because you could say that's an action, but it's also a mindset. The mindset was we want to choose the right people. And there was also a mindset of team working, that everyone participates and contributes to success. So here's where I think you start to see that even if you're not a patient association, even if your focus isn't hepatitis C, some of these mindsets are really the things that can create powerful success. So this idea of first choose the right people, then, encourage team working.
And another part of the mindset was the justice and equality, because they wanted really to give treatments to all people, all level of people, in a social and economic and in all level of reason in some way.
And supporting that also in terms of effectiveness was there was a belief in the efficacy of the drugs, and if that would work, then why not get this to everybody equally? I think that those things really go together. We start to see how this mindset really starts to build something very powerful.
And common desire to help, that is really related to choose the right people, because all the people who worked on this project was really motivated from some personal history. So they wanted to give back something, and they had the common desire to help others.
And then this belief and I think this mindset that we have always been resource catalysts. So again, this also goes with choosing the right people and the common desire to help, is that, right, we're all people that want to catalyze some kind of resources.
And the belief and the value that it has to be done quickly. They wanted to be fast, to be short in their time.
Because the lives of a lot of people were at stake. And again, as Emanuela was already pointing out, that there was a special motivation from personal disease experience, either having disease or having a family member or a person that you were close to that had that disease. And you see down there at the sort of the bottom of this, there was also this a very key aspect of the mindset, which was gratitude. Gratitude for being able to make this happen.
And then professionalism and expertise, because it's true that it is a no-profit organization, but they wanted to be really professional and to be prepared and skilled. So they followed a lot of trainings.
And they also put that into practice with, again, a mindset of strategy and planning and the capability of strategy and planning. So here we see these are things that can support very effectively, practically any kind of association. If you can get the right people, you can plan and strategize effectively. If you can build a professionalism experience and have teamwork, I mean, you've got really a powerful recipe for success. Now, we have another part that we want to show in just a minute, but I think I'd like to pause just now for a moment, now that we presented the model and we presented the case, or the basics of the case, just to see if there's anyone has any questions or any clarifications about this or any of the things that we've talked about so far. You can either feel free to put it in the chat, or you can raise your hand. If we can see you, you can raise your hand, or you can use the little mechanical hand if you have something. Anybody have a curiosity, a clarification, anything about the model or about the case, or even just a comment or a... It's all clear. I see.
No questions
I
yet.
see no questions yet.
Just
Kudos.
kudos. Thank you so much.
Thanks, Rob. Okay, let's go over the last part, and maybe that will raise some questions, because what did we do with this model? Why have a model? Because we said the first part is, okay, you gather that information, then you organize it into a model. Now, the whole idea of having a model is that you can put that into practice, because now we can actually go to different parts of the healthcare ecosystem and have them do a self-evaluation. And we usually start that with the outcome. So we have created an online evaluation, what do we call a healthcare scorecard. And it begins, we're just going to show you some screenshots, but this is actually all implemented online. And so this actually is kind of a combination of two different parts of the online survey. You sort of start with the red part is showing what is our current state. That's the red. And then the green is our desired state. So we usually will have people pick some time frame, because obviously you'd like everything to be 5s. But if you have, let's say, 6 months, you might not get to 5 on all of these things. So we took the different outcomes. So we start with the outcomes, and you rate, and that's what the red marks here are, that somebody has gone through, and they actually just kind of click on those boxes. What's the current level of engagement? So many key actors, are all the key actors, relevant actors, fully participating, or some of them not involved, or only some of them are? Is there a lack of support and respect and interaction between team members, or is everybody respectful and interacting effectively? I won't go over all the different questions there, or the high and low marks, but I think you get the idea that we're first having people kind of get that sense of where, from your perspective in the ecosystem that you are in, how would you rate what's going on from, in your ecosystem from your perspective? And what would be the desired state to achieve? This says in the coming year. Now, again, that year could end up being 12 months, or it could be 6 months, or for example, in this year, there's only a couple of months left. So what is it that I can actually concretely focus on trying to accomplish? Anything you'd want to add to that part, Manuela?
I can put in the chat the link for the online assessment.
Yes.
So I did now.
Great. What do we do with this is once we know what the outcomes are, because there is a relationship between the outcomes, the actions, and the mindset, we can then show, well, what needs to be improved. So we actually will have people also rate the current state of their actions in the similar way. I won't go over that, and Manuela has sent the link. You can look at how that works there. So the blue is the current state of the actions. The kind of gold is the current state of the mindset. And the green is all showing, here's the areas for improvement. This is what needs to be brought to a higher level. So we can, and we have, again, on the online survey, we can represent this in different kinds of graphs as well. But it really gives, here's a perspective of what needs to be improved or strengthened in order to reach those goals. So in this case, we see that for these outcomes, even just to increase some of those things a little bit, there's a lot of improvement that has to be made, especially at the enabler and connectors level. Anything you would want to add to that, Manuela, about them?
Yes, that we could use, and you could use this kind of assessment also when we work in the healthcare organization, to support them to learn and to apply those factors, and to improve some specific skills and or some specific mindset in order to achieve some kind of outcomes.
And so how do we do that? Because remember, we said a big part of the success factor modeling is we got to provide the tools and the methodologies and then give the support. So this is why we have developed our effective healthcare mindset skills training. We spent the last year and a half really doing this, and we delivered this last year, and Jean-Marc was there. He might even have something to share about that. But it's 5 modules, and what happens, the way we designed this, because we have an open seminar that we're going to be starting in January, but we can also go into specific organizations, to specific places, and say we can run this, and it doesn't have to be all the modules. For example, maybe they mostly need the enabler module or mostly need a connector module, so we can provide that. And so the way that we have designed that, and this is our upcoming program, but again, these are all modules that can be done independently, or they can also be sometimes combined. You know, we start with the connector, which is really founded on communication skills and using communications to clarify and increase expertise, as well as to empower others.
And then on February the 21st and 22nd, the enabler mindset about the value of compassion and the emotional intelligence for skills. And it's about using emotional intelligence for empowering communication, and about how emotional intelligence helps us to care more effectively. So you can see the empowerment and the effectiveness.
And then the catalyzer mindset is about problem-solving skills and this idea of catalysis, as we said, and it's about using that for efficient co-creation, but also for effective collaboration in order to increase engagement. So again, we can see that this is focused on particular actions and outcomes. These mindsets will support those. In our public seminar, that's in April.
And on May, the 9th and the 10th of May, the builder mindset about the competence and the self-awareness for skills. And it's about developing self-awareness in order to clarify where and how to expand the expertise, and about self-awareness, how it helps to be more engaged and collaborate better with others. And it's about you, if you are in the health and if you are working in the healthcare field, and it's about people you can support to do this.
Then we have the final module is the co-creator mindset, about the focus is on contribution and developing interpersonal skills, which then are applied to increase efficiency by co-creating with others, but also to be more effective by authentically giving care. Now, I want to say one thing. I mean, these are obviously very general descriptions, but each of these we have for the online ones, they're 2 half days online. And we also are going to have for people that want to actually become healthcare mindset trainers, we have a trainer training in June. But what we've really done here is we have really wanted to make this very focused and contextualized to healthcare. And one of the things that we do, and I'm going to open to any more clarifications or questions for just a moment, is we really want to make this so that you can see how it's applied. And one of the things that we've been doing is we have special videos that we're showing that show these different skills, how they look when they work well in the healthcare context, and when they don't work. So I think it's a really very how would I say, very powerful way of learning. Manuela, you might want to add something to that.
Yeah, it's. I think that in this case, if Jean-Marc would like to share something about the way of learning, because he was with us. Jean-Marc, would you like to say something?
Yes, Thank you very much. I would share my experience with this training. First of all, I would like say that I was very impressed by the relevance of the model. I'm a doctor. I'm practice in hospital now. In the circumstance, a difficult circumstance, and I was very impressed by the relevance of the model. It's very what I see in my teams, and I use very often the tools. That's my first remark. And for me, the discover of this vision of medicine that I had carried within me for years was realistic, feasible, and conceptually simple. And that's I loved with this training, that we share. We are many health care providers. There is some nurse, some health public, and we cross regards between, and that's also the force of this training is the possibility to change our regards, our view, our point of view. And the training permits this very well, because we have time to share, and it's very, very practical. And I was very happy to follow this training, and it's why I'm here tonight to share this enthusiasm.
Thank you.
Thank you, Jean.
Thank you.
And as like Jean-Marc says, what was really lovely is having people from different parts of the healthcare ecosystem. So doctors, nurses, other types of healthcare providers. And I think, as he says, that it's sort of that collaboration and that sharing of perspectives also makes you feel, yeah, it's more motivated, and that it, like he says, it's possible, you can do it. And that sometimes, as Jean-Marc was saying, that vision that you have is not just kind of personal and strange, it's actually shared by others. And as he said, it actually can be expressed in a simple and a practical way. So we have a few more minutes. Any comments, questions? I see there's one from Rob here.
There is, yeah, from
I
Rob.
was wondering, Robert, can we use this model in somehow to support us to support dentists and dentistry in bringing more excellence and success in the dentistry, actually?
Absolutely, absolutely. Because again, if you think about some of those outcomes, dentistry, the more engagement there is, the more expertise, the more efficiency, the more empowerment, the more effectiveness, everybody wins. And again, it's not only about just the dentist alone, it's also about the ecosystem that's supporting the dentist and dentistry. So absolutely, absolutely. In fact, we're looking to get some dentists for our qualitative interviews, because I've been to different dentists, and they're definitely not all the same. And the ones who are really able to have, I think, some of the most successful practices are doing these things, like we were, taking some of those actions, like communicating, caring, clarifying, co-creating. So absolutely, Peter, I think, and Ivan, I'm sure that's relevant for you.
Yeah, because we thought that even if we touch 1,000 dentist practices in Bulgaria, they can touch 1 million people in Bulgaria, which is approximately 14% of the population, so we can critical mass of the population of
Exactly.
Bulgaria. So we can use them as a lever to increase the quality of the
Beautiful.
interaction with the patients, and then they can have impact on more bigger area. This is what we were thinking. Thank you.
Beautiful. Yeah. I mean,
Yeah, also in the qualitative interviews, we interviewed one case from the dentistry industry. It was a company who provide some tools and some products to dentists.
so we can share that. we
Rather
can
a
share-
dealer.
Yeah.
It's more like a dealer.
Yes,
Yeah.
like a dealer.
Yes,
Yeah.
like, yes.
Hello, Robert.
Hi. So great to
So
see
good to
you.
see you. I've been hearing here on the side
Yeah.
because 3 in one screen. But I was very touched, just to share very quickly, I was just very touched by what you mentioned, that, you know, the patient is very often not in the center of the healthcare model, which is kind of strange because, you know, basically they exist to serve the patient. And
Yeah.
it's so common sense, but it's rather the expertise. What we found that in the last 5 years, we've been working with dentists in Bulgaria, and we found that they say they are working for the patient, but very often the expertise is
Yeah.
in the center.
Yeah.
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 Like
Yeah.
it needs to be shifted
Absolutely.
now
Absolutely.
on, and it's begging to be shifted.
Yeah.
Yes.
The patients at least are begging
And-
for a
And
shift.
this is again what I think is interesting, that our goal is to sort of, because you're so right, and our goal is to really help make that happen, because it's not because it's anybody's fault. That's why it does require a kind of a more total mindset shift. All these other areas have to also shift to support it, to make that possible for the patient to be in the center. You can't just say it. You've got to actually adjust these other areas and also have the skills and the priorities that do that. And I think that's what we have been able to, I think, show that it can be done. That's what I think these cases show, that it can be done and that it works. You know, not just that it's an ideal, but that it actually works.
Yeah, I'm very passionate about, I have it's a dream of mine to take like world renowned dentists who are really patient focused and model them how they do it.
Yes.
And just implement these principles and, you know, put them into action.
This, I want to say something, because if you do have passion like that in a project like this, one of the things, and Jean-Marc can, I think, can validate this, what we do over those 5 modules is that you do pick a project that you are working on. And of course, you are collaborating with other people who are also in the, in the class. So it is, its whole idea is that you are building a project, and we organize it that way.
Great.
And also I'm
Sounds all
putting,
right.
I'm putting in the chat the link of the last webinar where we shared another case from an hospital, from a digestive disease center, built by Professor Gasparini in Italy. And you can see another case of a new concept of a new philosophy that really wants and really put the patients in the center. So I put this in the chat. So if you if you want, you can look at that. You can watch it.
And of course, on our next webinar, we're going to be going over another case, which was the Italian transplant network, which was also very interesting, and some of the really interesting adaptations they had to make during the pandemic. I know our time is getting over, but I see Peter has had his hand up here.
And there is also a question about in the chat about the GDPR for the scorecard for the online assessment.
Yeah, so I think, all of our things are going to be, we're using the that information only to, usually it's going to be for very it's either just for the person who's using it, or it's going to be for a part of that ecosystem. So one of the things we're working on, for example, is a kind of a team report or an ecosystem report where various people within a system can use it, and then they're the ones that, of course, get those results.
And another
Thanks, Rob.
question is, I'm very curious as how you were able to flip or convert that client system dynamic, and what resistances you had to deal with. Institutions, infrastructure, this is how we do things here.
Yeah.
I think that's a longer question. Peter's had his hand up for a long time. So
Yeah.
he must be tired.
All right, we'll do Peter's, and then Rob, we will come back to it because it is actually it's an important point. But go ahead, Peter. Yes.
It is a virtual hand, so I don't get tired, but thank you for although if I were in the room with Robert, he would probably notice me quicker, which I can't. So, but my question is on a larger scale, because I'd like to know how applicable is this model outside of the ecosystem of the healthcare, because I work with the research leaders at the University of Glasgow, and
Yes.
they are working on different fields, not necessarily working in the field of healthcare as such, but they work on the more collaborative partnership and work that is done on a project base without much of a project experience. So how would you adopt this model if there's a possibility?
Well, that's a great question, Peter. Thank you for keeping your hand up for so long.
It was
actually,
again.
one of our qualitative interviews was with the Ministry of Health in Italy, where it's what they call the researcher pyramid. And so we actually did some really interesting, kind of qualitative study of how they organize their research, which was really interesting in order to also democratize that. And Emanuela, you might have some more to say about that.
Yes, because they worked on the role of researcher in the health field, for example, because there wasn't, and they built a process, a path, in order to give an identity to the researcher in the healthcare, in the health field. And then on the other side, they also built a process of something like a contractualization, and to give also a specific way of growing in that kind of role. And it was on the level of researchers, university, and academic fields, for example.
Yeah, because when we're thinking about researchers, it all starts in their mindset of that creativity and the purpose behind it. They may not have all the environment provided for them to explore those ideas, but they are the dreamers. So they'll come with the right ideas, but they may not know how to do it in the right way to realize those dreams. Yeah,
and that's why I think this a whole kind of collaborative network was there. You're right, because for us, a lot of what we're doing is, kind of looking at creating that loop between dreamer, realist, and critic. And again, I can't go into the details, but it was a really interesting thing they called the researcher pyramid, which is interesting because of the pyramid of the logical levels that we were looking at, but it was actually kind of very interesting, kind of an interesting parallel. So absolutely, I think it has great relevance to research, and we would be happy to share with you, what came out of our interviews.
And it was an inverted pyramid.
Yeah, that's the interesting.
I've seen in one of the books of Robert when he has inverted the pyramid, and the logical levels were inverted, and they were making a bit more exactly.
Yeah. Great question, Peter. I see we have another hand up here still. Yes.
Hi, Robert. Thank you for your wonderful sharing.
Yes.
I'm a dentist, so when you explain about the hepatitis C,
Yeah.
I was thinking about the tool decay all the time.
Yes.
And I know that doctors are very focused about the treatment part.
Yes.
I'm wondering, can we use this model thinking about the prevention of the disease? Because if I want to make oral hygiene revolution, I was thinking more about the prevention part. And can we apply this model, or maybe we should change?
Yes, no, absolutely. I think that the model has a lot of, again, you know, the model has a lot of implications for that. That I mean, even if you just think of those 5 outcomes, to prevent any kind of an illness, you're going to need efficiency, you're going to need expertise, you're going to need, you know, engagement, you're going to need empowerment, you know, and you're going to need those actions, you're going to need communication, you're going to need clarification, you're going to need co-creation, etc. So I absolutely, I think that model can be really effective for preventative things. And I'm trying to think, Emanuela, some of the if we have qualitative interviews where there was also a focus on prevention.
Yes, but also these about hepatitis C, because it's true that they started from the new therapies for hepatitis C, but the prevention, the point of view of the prevention was to avoid other liver transplants, to avoid, because to prevent from this by eliminating this pathology. So in every and also in CHEMAD, many things that we analyzed were about preventing, because by teaching the patients about some way, about some lifestyle,
like about nutrition, about lifestyle.
Yeah, and also by to have a good, a positive mindset. So it's a lot oriented to prevention.
Yeah. In fact, again, I think that all of the really effective, you know, sort of healthcare examples include as much prevention as they do, you know, specific treatment of symptoms. You know, one of the things that we've mentioned for the CHIMAD, which is the Digestive Disease Center, is that the Professor Gasparini, who was the founder of that, was saying every patient should have support for nutrition. They should have support for coaching support for lifestyle change. And I think that's going to be the future of medicine. I actually was just finished doing an interview the week before last here in France, in Paris, with an institute that started 4 years ago and has now treated 55,000 people. I think it's the first fully integrative treatment center in Europe, where they have whole teams of people. So each person has a team. They have individualized treatment plan for each person. And it's really amazing. You start to realize, okay, it's not just you have a symptom, here's the typical technical treatment for that symptom. You're really working with a whole person. So
yes, thank you, Robert.
Thank you so much.
This is
welcome.
wonderful. And the most difficult part for me is to change the mindset of the doctors.
Yes.
We'll start thinking about the prevention part, not only about the treatment part.
Yeah, exactly. And Jean-Marc, it looks like you have something to add about that.
Yes, I would testimony that 2 of the point of the models talk about prevency. I'm nephrologist. I'm work with people who have renal failure, and there is no symptom of the illness. So we must help them to treatment because they have no symptom. And that's the key of the change of habitudes for them. It's very powerful. It's if you know the video Simon Sinek it's the why of the vision.
Yeah.
And when you work with this kind of tool to ameliorate, first of all, for ourselves, for healthcare, to have this mindset, you could transmit to your patient the potential to practice their own illness, health care, and it's why I want to say that the model is very simple. The difficult is to apply it.
And Jean-Marc, you said something that's really important that we also emphasize here. One of the things that has always struck me about healthcare systems, especially hospitals, is, and it's one of the things we address in the program, is the lack of attention to their own health that the practitioners have. That I'm supposed to be a caregiver, but I'm not taking care of my own health. I'm working insane hours. I'm, I'm stretched to my limit, and I'm supposed to be there to help other people. So I think that's also part of this whole idea of the prevention too. It's like Jean-Marc says, it starts also with us. And that's something that we would like to also bring, because we think our healthcare providers also need to be, have their health put in the center. Well, I'm aware we've already gone over 15 minutes, and thank you all for staying with us. I do want to just finish here. We have a last little bit here where here is where you can, we can give you the information, but that's where we can find out more about this. But one of our metaphors, and you guys have been mentioning this about getting to 1,000 dentists and then 1 million people, is that and I'll let this is something that Emanuela has shared.
Yeah, this is one of my favorite metaphor from Buddha, because Robert and I, when we started this project, this study, we were alone, and so I think that thousands of candles can be lighted from a single candle. So we were a candle, and we started to spread this by enlightening other candles, and the life of the candles will not be shortened. So happiness, like awareness, like all of the things that we are spreading, never decreases by being shared. So welcome, new candles.
Yes, we hope that you bring your candle to this. So we also, in addition to passion, which is one of the driving factors, I think in our case, he is also talking about gratitude. So we have a great gratitude for being able to be in this position, and great gratitude for you all for joining us. And we hope to see you. Our next one is going to be, our next webinar will also be an interesting case of the transplant network. So we hope to see many of you back then. And thank you again for.
Thank you for coming.
Thank you.
Bye.
Thank you.
Bye bye.
Bye bye.
To see you.
Sending you a lighted candle, everyone.
Bye.
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 Bye. Bye, Irina. Bye.